I know of an incident in a hospital operating room which happened several years ago, in which the scrub nurse during the middle of a procedure was asked for a scalpel and proceeded to take it from her back table, from the needle mat on her back table, and give it to the surgeon. Just before she got it to him, he said, "Never mind, not now." So she placed it on her Mayo stand and placed her hand in such a way that it was relaxed and her thumb was up, and left it there. Then she looked on her back table for something else. Pretty much at the same time, the assisting surgeon who was standing next to the scrub nurse decided it was time to use the scalpel and reached for it, picked it up off the Mayo stand, and dragged it across and into the thumb of the scrub nurse. As you can imagine, not long after, the scrub nurse was down in the emergency department receiving stitches in the thumb, medication, and counseling. This was all for a totally preventable occurrence.
If you choose to work in an operating room environment, you encounter sharps every day. When handling these instruments, are you being safe? Do you comply with the recommended practices put forth by the AORN? The Centers for Disease Control and Prevention estimate that healthcare workers sustain nearly 600,000 percutaneous injuries annually from exposure to contaminated sharps.
As of June 2000, the Centers for Disease Control and Prevention had received reports of 56 documented cases and 138 possible cases of occupationally acquired human immunodeficiency virus infection among healthcare workers in the United States. Of the 56 documented cases of occupationally acquired human immunodeficiency virus infection, 48 were percutaneous, 5 mucocutaneous, 2 both percutaneous and mucocutaneous, and 1 case had an unknown source of exposure.
One target area that still remains an area of high risk for percutaneous injury is the operating room. Recent Boston Medical Center data indicate that approximately 40% of percutaneous exposures occurred within the operating room. The CDC estimates that 62 to 88% of percutaneous injuries could potentially be prevented by the use of safer medical devices. This film will depict many safety measures, and with the cooperation of the Boston Medical Center, the creators of this film hope to reduce your risk for exposure. Before we get into the particulars of dealing with each type of sharp, there are a few rules that should be followed when dealing with sharp things in general. Unless it is needed, avoid placing hands unnecessarily near sharps. Avoid needless handling of sharps. Avoid any sharp in the same hand simultaneously with another instrument. Contain sharps in designated zones at all times. Always keep your eyes on sharps until they are transferred to a designated zone. Always verbally announce the transfer of sharps.
We're doing more and more cases laparoscopically. Almost everything under the sun can be done that way now. Where we used to open a belly, we don't. We go through the scope. The instruments are very, very long and cumbersome and have many sharp points. We're using scissors and stapling devices, graspers, all of which are sharp and can be rather dangerous.
Besides passing laparoscopic instruments handled first, tip down, it is also wise to handle trocar tips in the same fashion as scalpels. Another basic OR safety tip involves the tying of sutures. Before tying a suture, remove the needle from the suture. Park the needle safely or protect the needle point with a needle holder. Besides these general situations, there are also some particular circumstances we should cover involving 3 different types of sharps: blades, sutures, and hypodermic needles. Blades come in many shapes and sizes. Always load or remove blades in an unhurried manner using an instrument or device. A surgeon or scrub person may designate a neutral zone using the no hands technique for the transfer of sharps. Finally, remember to dispose of the blade carefully. Sponging when the scalpel is in use may only be done when the surgeon does the sponging with the scalpel in the other hand. In this instance, the assistant will retract with the sponge only at his or her side of the incision. Another acceptable scenario involves the use of a sponge stick.
I work with a surgeon who does rather lengthy cases and uses quite a few needles in his procedures. We have a system that we've sort of gotten to manage where we use needles one-on-one basis, where we hand one up to the surgeon. He acknowledges he's received it, ties his little stitch, pops the needle off, passes it back to me, and I place it on the field into the magnetic needle mat that we use for our sharps. Then he ties his suture. He uses anywhere from 80, sometimes up to 100 needles per case. And it's a built-in, non-discussed method that we find that's useful and successful. It prevents a lot of the sharp sticks that can happen, you can imagine, with that many needles in a case. So as I pass one, he uses it, he pops it off, he passes it back to me, and I acknowledge that I've received the needle and pass it back onto my mat. I do not hand him a new one until he's given me back one, and so there's never 2 in action on the field at the same time.
The next category of sharps we would like to discuss in particular are sutures, which often come in packaging designed to facilitate easy loading onto needle holders without skin contact. Remember to always unload the suture from the package using the needle holder in advance and in an unhurried manner. Again, a surgeon or scrub person may designate a neutral zone for the transfer of sharps using the no-hands method. Keep your hands behind the needle and remember to take special care when manually adjusting the suture needle. Finally, remember the proper procedure for the disposal of suture needles. As would be expected, safety techniques for hypodermic needles are a little more complex. When assembling and disassembling devices with sharp components which require the use of both hands and opposing push-pull movements, both components are placed on a flat surface. Fill the syringe with the solution. Mount the hypodermic needle onto the syringe in advance and in an unhurried manner. As always, a surgeon or scrub person may designate a neutral zone for the transfer of sharps. Avoid recapping the needle if possible, but if recapping is necessary, place the needle and the cap on a flat surface. Now, let's review the basic safety tips for the handling of sharp instruments in the operating room. First, avoid unnecessary handling of sharps. Avoid placing hands unnecessarily near sharps. Avoid holding any sharp in the same hand simultaneously with another instrument. Contain sharps in designated zones at all times. Keep eyes on all sharps until they are transferred to the designated zones. Verbally announce the transfer of sharps. Always pass long laparoscopic instruments handle first, tip down. Handle trocar tips in the same fashion as scalpels. Always load or remove blades with an instrument. Remember to dispose of blades carefully. Remember to unload sutures from the package using a needle holder in advance and in an unhurried manner. Always mount the hypodermic needle onto a syringe in advance and in an unhurried manner. Never cross the room with a sharp instrument in hand. Always keep disposal containers close to the point of use. Avoid overfilling sharp containers on and off the sterile field. Replace as necessary. Avoid reaching for any sharp sliding of a drape. Always park the ESU pencil in the container when not in use. As you can see, there are quite a few rules to remember when dealing with sharps. These rules are reflected in the operating room policy at your institution. There is a level of competency required of all personnel who work with sharps in the operating room. And in most institutions, this competency level reflects the recommended practices put forth by the AORN. Ultimately, the goal should be not only to create the safest environment possible for operating room personnel, but to also provide the safest care possible to your patients. Attention to these valuable rules is the foundation for building a successful operating room.